We deal with pretty much the highest levels of stress that, people experience in the workplace.
Dr. Clay Whiting has spent more than 20 years in emergency medicine.
I've learned, over time, just the importance of, self care and making sure that I come in with the right mindset.
Before every shift, he takes a moment to prepare. Because inside the ER, it's not just about saving lives, it can be about protecting your own.
I mean, you imagine you stand up, you know, you stand up on a bed,
He's
right?
been assaulted more
And
than
you go
once,
jumping on
but an
somebody.
attack
I
5 years ago sticks with him.
All of a sudden, a patient stood up on the bed and jumped on top of me, bam, into the glass, crashed into the doors, landing on the ground before I knew it. And now I have someone physically on top of me, standing over me, literally throwing punches at my face and my head.
And he's far from alone. A 2024 poll from the American College of Emergency Physicians found more than 90% of ER doctors were threatened or attacked in the previous year. Todd Walbridge, a former FBI agent and now head of security at Scripps, says the attacks range from verbal abuse to brutal assaults.
Using hospital medical equipment as weapons to punching, kicking, spitting, grabbing, hair pulling. But we're reducing that. This year, we were able to reduce hospital violence by 31%. It had been on the rise for 3 years prior to that.
A 2024 report from National Nurses United found hospital violence is leading to healthcare workers leaving the field and staffing shortages. Whiting says he's cut his shifts by 25% because of the violence.
There definitely have been healthcare workers at this facility that have left the hospital because they've been attacked to the point where they have PTSD and they're afraid to take care of patients.
The nurses union says additional action is needed to protect healthcare workers. A California law that went into effect last month raises penalties for assaulting ER workers and increases jail time from 6 months to a year. Walbridge says hospitals, including Scripps, are also investing in training.
It's a combination of de-escalation training, self-defense training, and working with patients to try to identify people who are on a trajectory towards violence and begin the de-escalation process sooner rather than later.
Hospitals are also stepping up security. Some have installed metal detectors. Security officers wear body armor and carry tasers. This month, Scripps will have a new visitor registration system to track everyone entering hospital buildings.
Hospitals are kind of the last business in San Diego where you can just walk in and wander through the halls.
Whiting says no charges were filed against the man who attacked him 5 years ago. This new law, he says, is a long overdue step toward justice.
So I think that it will help healthcare workers feel that, if and unfortunately when we are attacked, that maybe some real justice can occur.
But Walbridge says the law, which charges assaults as misdemeanors, doesn't go far enough.
What we would have liked to have seen was a felony for everyone in the hospital who is assaulted. That's the equivalent to what happens to an emergency worker outside the hospital.
The law only applies penalties to violence inside the ER. Attacks in other parts of the hospital are still treated as a lesser crime. Despite the risks, Whiting says he will keep showing up.
When I begin each shift, I think it's important that the message that I try to convey and bring to the bedside is that I'm here to try to listen, help, and heal. I'm not here to judge.
Still hopeful, still committed to care. Heidi de Marco, KPBS News.